Future trends and contraception. Future trends and contraception. COC or combined oral contraceptive, also known as the birth control pills, provide reliable contraception as well as several non-contraceptive benefits. COC contain an estrogen component in one of the dozen different progestins. Estrogen is responsible for the most of the side effects associated with COC. The side effects of COC: nausea or vomiting, headache, mood changes, breast tenderness, weight gain, acne, and reduced libido. Breathable implants do not have to be removed, or an estrogen-based gel that is rubbed onto the skin may be used in the future. Biodegradable contraceptive implant. Effective contraceptive placed under the skin. Similar to but much smaller than an implant. Easy to insert. Biodegradability would eliminate the need for the removal at the end of 1 year, but can be removed. Landscape analysis of manufacturer underway. Pros of biodegradable implants: long-lasting, limited side effects, do not interfere with daily activities, low-cost procedure, no need for routine check until the removal, can be inserted at any time as long as the woman is not pregnant.
Cons of biodegradable implants: irregular periods, weight gain, no protection against STDs, medical assistance required.
Progesterone-filled vaginal ring that is permanently implanted is yet another possibility. Birth control vaccine consisting of antibodies against human chorionic gonadotropin hormone is distant possibility.
Injection of testosterone for males, which halts sperm production just as estrogen halts overproduction in women, are being tested at the major centers. Hormones-related contraception, however, has inherent problems because sperm production is continuous. There is not just one event, ovulation to halt. Administration of FSH and LH to men could stop sperm production through effects on the hypothalamus. However, this approach should also decrease production of testosterone, which is necessary for male muscle strength, until the matter of how to balance the amount of needed testosterone and excessive testosterone, which produces aggression, is solved. Hormonal male contraception remains an elusive concept.
Until some method is found that satisfies all of the criteria for an ideal contraceptive, completely safe, no side effects, low cost, easy availability, easy reversibility, and user acceptability, both women and men need opportunities to discuss options to find the method right for them.
The elective termination of pregnancy or voluntary abortion describes the interruption of pregnancy before viability at the request of the woman, but not for medical reasons. Most abortions or terminations of pregnancies are done elective, and thus it is one of the most frequently performed medical procedures today. Elective termination of pregnancy is a procedure performed by a knowledgeable healthcare provider to end a pregnancy before fetal viability. Such procedures are also referred to as therapeutic, medical, and induced abortions. Unsupervised abortions are termination of pregnancy performed by unskilled people, often under less than sterile condition at any point of pregnancy. Unsupervised abortion carry a high risk for infection or excessive bleeding that can lead to death. Reasons that elective terminations are most often requested. First, it threatens a woman's life. Second, involves a fetus found on immunocentesis to have chromosomal defect. Third, not wanting to be a single parent. Fourth, do not want more children. Fifth, having financial problem. And lastly, failed contraception. In the United States, although drugs to induce abortion safely are available, selective terminations of pregnancy is still mainly a surgical procedure. Nurses employed are asked to assist with such procedures as a part of their duties. Wade 410 U.S. 11.3 of the 1973, the Supreme Court ruled elective terminations must be legal in all states as long as the pregnancy is less than 12 weeks.
Induced termination. Mifepristone RU-486 is a progesterone antagonist that blocks the effect of progesterone, preventing implantation of the fertilized ovum and therefore causing the pregnancy to be lost. Mifepristone is not solely used for induced termination, and so may also be prescribed to women for regression of uterine leiomyomas or detoxification in cocaine overdose. When used for a medical termination of pregnancy, the compound is taken as a single oral dose anytime before 63 days gestational age followed by buccal or vaginal misoprostol, a prostaglandin which causes uterine contraction. Some women may also be prescribed an antibiotic as prophylactic protection against infection. Another medical regimen is methotrexate and misoprostol. Methotrexate also used to end ectopic pregnancies or thromboblastic disease.
Medically induced termination of pregnancy is contraindicated if a woman has a confirmed or suspected ectopic pregnancy. Only methotrexate is used, and the woman needs additional follow-up. Next is an IUD in place. In serious medical conditions such as chronic adrenal failure, a history of current long-term systemic corticosteroid therapy, a history of allergy in mifepristone, misoprostol, or other prostaglandins, a hemorrhagic disorder, or is taking concurrent anticoagulant therapy. Advantage of medically induced over surgical termination: decreased risk of damage to the uterus through instrumental insertion, decreased use of anesthesia necessary for surgically performed procedure. Complications of medically induced termination: nausea and vomiting, diarrhea, severe uterine cramping, incomplete abortion, possibility of prolonged bleeding. Elective surgical termination involves several different techniques depending on the gestational age at the termination is performed. Next is menstrual extraction or suction evacuation. Is performed on an ambulatory basis 5 to 6 weeks after the last menstrual period. A narrow polyethylene catheter is introduced through the vagina into the cervix and uterus that would be shed with the normal menstrual flow, is suctioned and removed by the vacuum pressure of a syringe, dilation, and curettage. Dilation and curettage, or D&C, is used when the gestational age of a pregnancy is less than 13 weeks. This done in an ambulatory setting using a para-cervical anesthetic blocks that does not eliminate all pain but limits what the woman experiences to cramping and a feeling of pressure. Next is dilation and vacuum extraction, or D&A. It is used with terminations between 12 to 16 weeks of gestation. They are done in either an inpatient or ambulatory setting. In some centers, dilation of the cervix is begun the day before the procedure by administration of buccal misoprostol or insertion of a laminaria, seaweed that has been dried and sterilized in the cervix. Prostaglandin or saline induction is used if the pregnancy is between 16 to 24 weeks and is done on an inpatient or same-day surgery basis, following oral misoprostol or vaginal laminaria to prepare the cervix for dilation. Prostaglandin F2 or E2 is administered followed by 20% saline injection into the uterus. Saline is hypertonic, causes fluid shifts and sloughing of the placenta and endometrium. A dilute intravenous solution of oxytocin to assist the start of contraction may also be used. Pain from the procedure is similar to natural birth but can be controlled by analgesics and breathing exercises. Psychological aspects of elective termination of pregnancy. Women of all ages request elective termination. For such a procedure, the usual profile is a woman who is young, isn't married, had no previous live births, undergoes the procedure to end an unintended pregnancy, has not taken any adequate protection against becoming pregnant. Lastly, has become pregnant because of involuntary coitus from intimate partner